Hello everyone, my name is Andrea Chen actually now. So for my practicum, I partnered with the Office of the Seniors Advocate to develop a report on the role of case managers within BC health authorities. My goal was to develop an understanding of case management and the process through which clients receive services from point of entry to service delivery. Specifically, we focused on seniors as they are the majority users of home care services. So to obtain information for my report, I first went out to local health authorities, local health units, so like Saanich Health Unit, Gordon Head, Oak Bay, and I followed some case managers and got to observe them in their day-to-day activities. I also spoke with managers and directors of their respective health units, and they provided me with some aggregate data. And then I completed a literature review. So currently there are 3 categories of subsidized care available to BC residents. You have in-home services, so those are things like home supports for activity of daily living. So that would be like personal care, dressing, bathing. You can have nurses come to your house, assist you with doing delegations of tasks for medications. You know, physios can come to your house. Then you have out-of-home services, so adult day programs where the client actually goes to a facility, they engage in activities, share a meal, and it's in a centered staff by healthcare professionals. And then you have things like respite, assisted living, and long-term care. Respite, you're going to a facility for a short period of stay, up to 3 weeks generally, and then assisted living and long-term care is when you actually are making a permanent move to a facility. So some of the aggregate data that was collected from health authorities informed us that almost all case managers within Island Health, Fraser Health, and Interior Health are registered nurses. However, of the 200 employed case managers within Vancouver Coastal Health, only about 56% are registered nurses and the rest are social workers. We speculated that is likely just due to the large population of downtown East Side and requiring more social work expertise. Otherwise, data remain consistent for caseloads, averaging about 75 to 90 clients per clinician, and they're able to complete about 5 home visits a week, so 1 a day. So anybody 19 years of age and older can access home and community care services. You just call your local health unit, your friend can call, your doctor can call for you. They'll complete an initial screening over the phone to determine whether or not you're eligible. And if it's determined that you would benefit from supports, a case manager will be assigned to you. Case managers are assigned based on geography, so they all have a distinct district, and everybody in that district is assigned to them. This diagram just represents the care process from point of entry to when service is delivered, so I will speak to that. So once you're appointed a case manager, they come out to your house. It's always done in person, the initial meeting. They'll complete a detailed assessment to obtain information. They're not just focusing on physical health. As we all know, much more than that contributes to the wellness of an individual. And then once they are privy to all these details of an individual's life, they're going to pass this along to other members of the interdisciplinary team, so perhaps to your GP, or they also send what's called transfers of information to the hospital, to hospital liaisons, and this includes information on your status prior to hospitalization, what supports you currently have in place, and what needs to be addressed prior to discharge. So client-driven, collaborative, patient-centered care. These are 3 terms that represent core characteristics of case manager. There has been a big shift towards like mutual participation and shared decision-making. So it's obviously a collaboration. It's not just the clinician telling the client the way it is and what's going to happen. And this has also led to improved satisfaction and improved adherence to the care plans that they collaborate to come up with. So when they're generating these care plans, they're aided by the use of what's called the Residential Assessment Instrument tool. This is a standardized tool. It's been in effect since 2005 across all BC health authorities. So it's a software where clinicians are inputting information about the client's needs and strengths, and then the software is determining service eligibility for both in and out of home supports, as well as whether or not they can access care facilities. And finally, we move on to care delivery and evaluation. So once a care plan has been designed, the case manager must initiate and coordinate services and supports. And then they're working in conjunction with healthcare workers to make sure that the individualized care plan is being fulfilled, and then they're making adjustments accordingly and determining whether new interventions need to be implemented. So when I was completing my report and my lit review and going out into the community, the first issue that I identified was one of role clarity or lack thereof. Basically, there does not seem to be a general idea of what a case manager does. A 2016 study determined that clients thought of case managers as like a friend, someone to keep them company, listen to them, and to defend them or their opinions. And why is it important? Why is it important to actually understand what a case manager does? Well, it helps manage clients' expectations with regards to the work, so then they'll be better informed of what services might be available to them. And it ensures that hospital staff are making appropriate discharge referrals on discharge to ensure continuity of care for patients. So obviously, recommendation is to be able to concretely identify the duties and responsibilities of the role and come up with a clear definition of case manager. I think there's obviously a ton of advantages to being able to clearly define a role, but one that I identified was that it would assist managers in hiring and recruiting and retaining the right people for their organization. If you understand the roles and responsibilities, you'll be more inclined to determine whether or not it'd be a good fit for you. And it can also potentially accelerate the training process if you have clearly outlined responsibilities, because it currently takes about 3 months to orient to the position, and it takes about a year before you're able to handle a full caseload. So it's pretty lengthy amount of time. As well, it allows case managers to have set roles and responsibilities and know what is expected of them and understand how to accomplish these objectives. So clear targets would obviously allow executives to analyze policy, evaluate performances, and provide concrete feedback and recommendations to improve workflow and enhance clients' healthcare interactions. Another issue I identified is the lack of technology. Even though case managers estimate that more than 50% of their time is spent documenting and recording rather than doing face-to-face visits with clients. Currently, there is no policy in place within BC mandating the use of technology. They do recommend it, but there's considerable pushback because clinicians say, oh, it creates a physical barrier. If I have this big laptop between myself and the client, also it's hard to adapt in a client's home ergonomically. A lot of these individuals that you're seeing are seniors. You're just sitting on a couch. They want you to have a cup of tea with them. It's kind of hard to put a big laptop down. As well, it can be quite time consuming for those who are inexperienced in typing. So a recommendation is actually to create standardized policy and mandating the use of technology, as oftentimes recurrent use does allow individuals to become experts, and then over time they will start to appreciate the time-saving value of the technology. As well, having more tablets available for clinicians throughout all health authorities, because as we all know, things like iPads, tablets are less cumbersome, less formal. You can use a stylus pen to mimic pen to paper, so that's beneficial for those not super experienced in typing. And there actually is policy in place in Ontario that mandates the use of laptops for clinicians when they're in the field or when they're at the hospital bedside, and this is proven to allow clinicians to interact with clients while simultaneously completing the residential assessment tool. So negates that use of double charting that is such an obstacle for clinicians. Another issue I identified is this financial assessment role. So case managers are actually responsible for gathering all the notice of assessments of their clients and then inputting them to the system to determine what rate you pay for your home supports and your subsidized care facilities if you're moving in that direction. But the Royal Jubilee and Victoria General have recently been trialing having a financial assessor whose sole purpose is to gather this information and input it and be in contact with clients to let them know what their rate is. And I think that would be beneficial in the community as well because it allows clinicians to interact more with clients face-to-face, and it has a potential to avoid cost errors as most case managers are not experts in finances. Okay. The last issue identified is this issue of having a primary care clinician. So currently, individuals with complex care seem to have multiple clinicians being involved. So they have an OT, a social worker, maybe a nurse, a case manager. It's very confusing for them as to who they should communicate with. So I recommend that they have a primary care clinician, so someone who's their main point of contact, who then diverts everything out to respective clinicians. And this ensures continuity of care. So it involves an ongoing relationship between client and provider, proper information dissemination, and bridging care from different disciplines. So that reduces gaps in service and allows for more positive client-clinician relationship. So in conclusion, with increasing pressures, caseloads, and acuity of clients, the introduction of appropriate resource and policies needs to occur to better assist clinicians to support clients and families as they navigate the home and community care system. Case managers ensure the right care at the right time to the right people. So I think ensuring that they are properly supported is essential to ensuring our senior citizens continue to be supported in their communities. Well done.
So before we have our break, are there any questions? Yes. Oh, 2 questions.
I have a couple questions. One, I just wanted to make sure I understood your numbers correctly. So one case management manager might have 75 to 90 cases?
Yeah, clients.
Clients.
Yeah.
So does that mean they see them every 5 or 6 weeks?
Not realistically, because usually they have more complex clients who take up more of their time. So if you're kind of just like more maintenance, then no, they would generally not check in with you. You'd have to call them.
Okay, my other question was, you mentioned that there was a technology tool for developing the case plan?
The residential care, yeah.
Residential care plan?
Yeah. It's called the RIE, yeah.
Yeah, so I just wondered, does the case manager have the discretion to override that if the result doesn't seem to match the person they see in front of them?
So yes, of course, they can do that, and they can also change whatever information they inputted to get the numbers that they want, which they do fairly often. All the time.
Hi. Yeah, hi. It was a great presentation. I actually work as administrative support for our transition team at the hospital, which does the home services. And I was curious because you said that most of the people working are either RNs or social workers. Is there any look at all in expanding that to also include case managers that might be LPNs, occupational therapists, or physiotherapists?
So I'm like a hospital liaison at Victoria General, and we've recently employed an LPN. So we do have one there. And there's one at RGH, I think. But, you know, RNs are pretty protective of their jobs, so don't foresee that happening anytime soon. Yeah. Yeah. Yeah, it's a good idea. Yeah.
Good. Well, Andrew, thank you very much for an excellent presentation. Thanks.